Good evening, everyone, and welcome to the Healthy Debate. On this show, we respect and promote freedom of speech and everyone's right to their own opinions. We're committed to exploring a wide range of topics, with guests representing all aspects of the political and medical spectrum in this country and abroad. We'd like to thank you all for your overwhelmingly positive response to our first show last week. We're proud to have broken new ground in the Covid-19 discussion, and we remain resolute in our aim to have normal life restored to us all as soon as possible. For this, our second show, we have a packed programme. We'll start by looking at how the use of words has influenced the public debate on the subject of COVID, and then take a look at the controversial PCR technique which has been used to test COVID-19 since the start of the epidemic. But first, we'll start with a roundup of COVID-19 news at home and abroad. At the weekend, a second group of Irish doctors broke rank in calling out NPHET and our political leaders for their scattergun attempts to control the virus. Among them were Jim McDaid, a former Minister of Government and a local GP in Donegal, and Michael McConville, a Monaghan GP. As with the first group of doctors who voiced their concerns, they've been largely ignored by the mainstream media. Also at the weekend, a certain amount of outdoor carousing in South William Street in Dublin and elsewhere was captured on social media. Yesterday, the government announced that it would ban the sale of takeaway drinks from pubs for the remaining 2 weeks of the level 5 lockdown. Yes, folks, we've 2 more weeks of this. That move was put on hold after a cabinet meeting earlier today. In general, the number of so-called COVID cases continues to fall, though not as sharply as last week when the effects of a more rigorous approach to testing became apparent. As is usual at this time of year, there's a rise in respiratory illnesses, and we always have to take this into account when talking about COVID. Internationally, it's all about vaccines, as I'm sure you all know. There's 10 of them at the last count, all of them claiming success rates of 90% at least. So what does that mean exactly? And is it any better than what we can expect from a healthy immune system? These are the questions we've got to ask, but we will not be doing it today. Countries continue to take differing approaches to the so-called second wave of the virus. France, the UK and the USA are as chaotic as we are here. While Sweden, a bastion of common sense up to now, is advising against gatherings of more than 8 people in the last week or so. On an encouraging note, a pots and pans protest, I'd love to have heard that, outside the parliament in Copenhagen has forced the Danish government to back off from more draconian restrictions on the rights of citizens to live normal, healthy lives. And from Portugal came more good news when the appeals court ruled that results from the PCR tests were unreliable. That obviously is one topic we will be discussing on this programme. But before we get into the PCR test, which will take up a good bit of our time, we're going to look at words, the words that were used to define this so-called epidemic, and how they've not only shaped the agenda, but divided the nation into 2 camps in a pretty disastrous way. We'll start, our first guest is Sara Haboubi, an expert on the use of words, through her work as I'm going to have to say this carefully, on her work as an NLP linguistic practitioner. Sorry, no, I got it wrong. I'm leaving it to Sara. You explain what you do, please.
Thanks, Lindie. Yeah, it's NLP, horrible name, but fantastic set of tools. It stands for neuro-linguistic programming, and it's all about communication, how we communicate with ourselves and how we communicate with other people, and the impact that actually has on our lives across the whole board. So I've been doing that for 18 years.
So tell us about words.
Words. So for myself, listening to the news and to the government, and obviously I was like everybody else tuning in at 6 o'clock every evening to see, what had happened that day, how many more deaths, etc. And I was really listening to how it was actually being portrayed as to what was actually going on. And like everybody else, I became very afraid when we started to hear the predictions. Mm-hmm. However, when the curve obviously peaked and started to go down, and I was expecting celebrations and a very positive response, what I started to hear instead was actually this hesitancy to open up and everything else. And then I heard something that really shocked me, which was there will be no getting back to normal without a vaccine. And I just thought, really? Well, that's a bit strange because I've lived through SARS. I actually lived in Bangkok at the time. Everything went back to normal. We've lived through swine flu. Everything went back to normal. We've lived through MERS. We've lived through, numerous pandemics and managed to get back to normal without any of these things. And I just couldn't understand this. And then I, from my own limited knowledge around vaccines, know that as far as I was concerned, it would take, 10 years to develop a safe and effective vaccine. And again, if this was a coronavirus, they've never developed one for colds. So just from my own, knowledge of the world and everything else. And I'm not, both my children are vaccinated. I'm vaccinated. It wasn't about that. Yeah. It was just about, this very, very short rushed, time frame. And I started to then really listen to how this was actually being delivered in terms of the message they wanted to send to people. I actually started to do my own set of interviews through lockdown to help people with reducing their stress levels, because it is very well documented that the more stressed you are, and obviously chronic stress, your immune system is also compromised. And for me, my life's work for the last 18 years has been about helping people to reduce their stress levels. And in a moment when you're sitting at home and nothing is going on around you, to be sitting worried and terrified, that's not helping you in any way, shape or form to actually stay healthy and well. So I started to really listen to this. And the other day on Twitter, I actually just threw out a question. And the question was, what words or terms, phrases have you come to loathe in 2020? And I had over 1,200 responses within 24 hours. And it was pretty much the same things. And it's really interesting because when you start to really pick apart a message, to look at what's the intention and what's the outcome, what's the result of this message, you start to see a pattern emerging with this, which is very much that instead of it being about helping people to be calm, get on with their lives, because we've still got jobs and kids and everything that we need to do, it seemed to be designed to actually elicit as much fear as possible. So even the actual term itself, pandemic, my 14-year-old said, why are they using that term? It sounds like panic-demic. And I thought, it does, doesn't it? If I hear the word pandemic, I immediately think there's going to be thousands of people dying around me. There's going to be people dropping dead in the street, which of course we saw the images from China, supposedly, of people dropping dead in the street. And I think that terrified people. And we were shown the images of the ICUs, the hospitals. Yeah. And I've seen that same image now, exactly the same image. Footage was used in Bergamo. It was used then in New York City, and then it was used in Melbourne as well. The exact same footage. They've been, we've seen that. So it's very strange. It's like, what's going on here? Yeah. So the messaging, and even things like the COVID yellow that's everywhere. Yellow and black is designed to, it's danger. When you're going around a corner, it's the chevrons. In labs, it's yellow and black. So these messages, I was looking at them, and they appeared to be crafted very carefully to make people very, very scared. And I just kept thinking, okay, what's going on? And when we started to see the numbers, and the numbers were not, lots of experts around the world were saying, look, flu is not a picnic if you're elderly and frail and everything else. It's not saying, oh, it's just flu, but it's saying it's not any worse than flu. So this was a very, it seemed to be mixed messages. And 1 minute you're saying, don't wear a mask, they're not useful. The next minute is wear a mask, and there's confusion. And when people get confused, they get anxious. They want leadership. They want to just be told, well, what do I need to do, to be safe?
What though? Give us some of the expressions that people really, really have come.
Oh yeah, so it was actually. One person said, "Where do I start?" and proceeded to, and they went, actually, it was quite cathartic, which was great. So one of the ones that seems to be the least favourite is "Stay safe." So stay safe. Immediately you go, why? What do I need? What am I? What do I need to be safe from? Where's the danger? Of course, we can't see this thing, so it becomes this. It could be anywhere. It could be anybody can have it. Some of the other expressions. I do actually have a slide. It's got the COVID yellow at the top with some of the expressions. Things like, it went from flatten the curve to eradicate. There seems to have been a shift. So 2 weeks to flatten the curve. Yeah. So flatten, and one of the interesting things actually is how much kind of war metaphor has been used. You know, we're going to beat this. Even the term frontline workers. If you think about the front line, that's the front line in a battle. You know, in a war, they're the ones who are the most exposed. They're the ones who are the most vulnerable. You know, so this term frontline workers. You know, this the whole idea of we're going to beat this. You know, we're all in this together. And again, while you might think, well, what's wrong with that? You know, we are all in this together. Well, the reality is, we might all be in the same storm, but we're certainly not in the same boat. Everybody's got everyone's dealing with this completely differently. There's not the same reaction to this. Some people are loving it. Some people love working from home and things like that. But other people are really struggling with their mental health, with losing jobs, with not being able to put food on the table, things like that. These are real problems that are being experienced. And the reality as well is this whole war metaphor. It implies that self-sacrifice is needed, and also that there is going to be collateral damage. But the problem, of course, is the collateral damage really has been not just our healthcare system in terms of non-COVID, you know, these things that are non-essential, which how do you know if it's non-essential? If you're going for a regular test, I have my own, you know, family experience of a regular test that showed up something very sinister. And I just kept saying, thank God this was last year and not this year. Because that would have been cancelled. We never would have caught that in time. And I'm so grateful. But what about those families who haven't had that opportunity? You know, so this thing of collateral damage is, and because it's also our constitutional rights have been collateral damage.
I think we will, at this point, maybe bring in Dr. Pat Morrissey, if you're there, who's a GP. Are you there, Pat?
Hi, Lindie.
Are you, Pat?
Hi, Sarah.
So you've heard there what Sarah was saying about the stresses on families. How have you found it in your own general practice as a doctor?
Yeah, what Sarah said there really struck me. This culture of fear, it has a very negative effect, and this sustained fear over such a long period of time is having a very negative effect on patients. And this is what drove me to speak out. There's no doubt in my mind that the cost-benefit analysis on lockdown is very, very negative.
Yeah.
And in my own experience, in my own practice, I've seen at least a tripling or a quadrupling of the number of patients coming in with mental health issues. I've had patients suicidal, blaming the social isolation that they've been experiencing. I've had one suicide in my practice from related to a patient who was denied treatment for a serious condition due to the lockdown. I've had all my alcoholics I've become very familiar with during the last 8 months. All my alcoholic patients, you know, their ability to cope and manage their issues has got a lot worse. And it's very, very disappointing because some of these people had been abstinent for long periods of time, and you know, they've hit a real rocky patch. And that's on the mental health side of things. On the physical health side of things, I've seen I've quite an established practice, and I took over a practice from another doctor, so I have a lot of older patients, and I see my older patients getting frailer and deconditioned, as we would say in medical terms, over the lockdown, because they're missing out on social interaction, they're missing out on their exercise and their activities, their aqua aerobics, they're going out and play, you know, their weekly card games, they're meeting up with friends and family for whatever family occasions might be, you know, and these are very important, you know, social interactions, but they're very important for physical and mental health as well. So that's that side of things. And also the biggest killers in Ireland are cardiovascular disease and cancer. Yeah. And it's got increasingly difficult to get patients seen and looked after with these conditions. I had one man who died of a heart attack. He had been referred well before the lockdown. He died during the lockdown, and in normal circumstances he would have been seen, you know. Yeah. So it's very sad. There's no doubt. Just I'm speaking, it's anecdotally, it's just my experience, but there's no doubt in my mind that the collateral damage from lockdown is much worse than the benefit from the reduction of COVID. Because I've seen a lot of COVID as well. In my own practice, I've dealt with practically maybe 100 patients at this stage, thereabouts. And I worked and was involved in setting up a COVID community hub, the first one in the Midwest in South Hill. Right. And I dealt with COVID patients there. And, so I've seen a fairly broad spectrum of what this disease can be and what it can do to people. And it is serious for some people, but these people are identifiable, and 90% of the mortality is in the over 70s. And we can identify who's at risk, and we can take measures to protect them. And I believe at this stage, and with the experience that we've garnered, that we can surely refine and target our resources in a way that allows a functioning society again. And a functioning society is a healthy society, and at present our society is quite dysfunctional. I think we could all agree that.
Yeah, absolutely. The letter, you signed the first letter, didn't you? The doctor's letter that went out in the middle of October. Was there any response from officialdom to that letter at all?
All I can hear is crickets.
What?
Silence.
Yeah, it's desperate, isn't it? But yeah. I'm going to get back onto you about the testing, because as we all know, one of the problems is that a lot of us don't really know what COVID is, because it's tested with a procedure called the PCR technique. I don't like even to call it a test. And our next guest, we will be getting back to our two previous guests, is Kevin Corbett, who's he's a clinical nurse for over 37 years at various levels in England. His parents both come from Ireland. He's actually, we decided, probably the most Irish person on this programme. And he first came across PCR testing when the HIV/AIDS crisis hit hospitals in the 1980s. And Kevin, can you hear me there? I can't hear you. Kevin? Hold on a second, Kevin. Have we got you now? Kevin?
I think so.
Yeah. Kevin,
hello.
Could you explain exactly what is PCR?
Well, in a simple way, I think a good way of explaining it is that it's a way of amplifying something, magnifying, multiplying something. So you start with X, you put it through the process, the PCR process, and you get 1 million X or 10 million X or whatever. And it's a way of amplifying what's called genetic material. So this is what they're using it for. The PCR stands for the polymerase chain reaction, and it's an amplification reaction that was invented by somebody called Kary Mullis, who received a Nobel Prize for the invention eventually. And it's a highly sophisticated technical process. And my experience with it was from the 1990s, when I was doing research as a health scientist and a registered nurse on patients for HIV who were diagnosed HIV positive and had T-cell counts, but they also had viral load tests, which was a type of PCR test that was used for AIDS patients to stage the disease, to see. Technically, they said it was a way of measuring how much virus was in their blood. However, the readings that people got were vastly different. So the people I interviewed would have a PCR test of, say, X from one hospital. They may have it done in another hospital a week or two later, and it'd be quite different, it'd be 3X or 4X. So they got vastly different readings from different hospitals within a short space of time. And that was because it wasn't standardized. It's hard to standardize it. And again, this is what you're seeing now, the the PCR used to diagnose SARS-CoV-2, which we're told is the virus that causes the new disease category called Covid-19. And this is the problem with it, because it's very difficult. There's no international standard for how many cycles that you have in the process. So what's called the cycle threshold, it varies, and that's like the cutoff for the test to how to read whether it's positive or negative. So, in Ireland, I think you've got slightly different standards to United Kingdom. And if you look at the United Kingdom standard operating policy from the National Health Service, it does admit, when you read it, that you can have cycle thresholds of over 40 or 45 or over 30. So if you take Anthony Fauci in America, I think we all know who he is, don't we? Anthony Fauci. He said in the summer that if you go beyond 35 cycle thresholds, then you'll never ever be able to isolate virus because it's giving false positive readings. And I think that's a very interesting topic then to look at, what's beyond this test. How do we know these tests work?
Exactly.
And as a sociologist, as a social scientist, I look at the debates in this whole area, and there are a lot of debates around how you standardize a test like this. And it should start with having a viral isolate, to have an isolated virus. And when they developed this test earlier in the year, it was developed across Europe by European health agencies like the United Kingdom's Public Health England, the Germans. Drosten was a lead scientist involved in the test. And they used genetic sequences and not viral isolate. In the paper that was published in January 2020, they said that they did not have a viral isolate released by the Chinese, and they used genetic sequences that were incomplete. And this is where it gets quite controversial, because virology has become geneticized and it's focused on genetic sequences, but genetic sequences are not a virus. They're not a morphology. They don't have the form of a virus sometimes. So it's very debatable. Some scientists are saying this virus hasn't actually been isolated in terms of purified isolate. And there you have it in black and white. We just had it on the screen, where they admitted that they had sequences released by the Chinese, no viral isolate. They had to go onto Chinese social media to check whether it was a SARS-CoV virus. And then they inserted into that sequence what they thought were the missing sequences. So, on a basic level, there's questions about all of this. And when I asked Public Health England in May why they don't isolate the virus to calibrate the test as a gold standard, and every medical test should have a gold standard, they said, the answer to me is very simple. They said, World Health Organization told us not to isolate the virus. And they gave me the document that said that. So the World Health Organization has told all the nations of the world not to isolate this virus. And there is a woman in Canada who's coordinated all the FOIs that people have put in to their own governments, asking for where the virus has been isolated. So this is not people making this up. This is actually true, that they use genetic sequencing here because virology has become more geneticized, and no viral isolate to underwrite the way these tests have been calibrated. And that's why these tests really, they give false positives and they give false negatives. There's great inaccuracy, some as much as 4 or 5% false positive, and similarly, sometimes even more false negatives. So this is a problem with these tests, really.
Isn't it also the case, though, that as a virus wanes, or there's some argument that when you flatten the curve, let's say, that there's a higher likelihood of getting false positives, which is quite difficult to understand, really.
Well, I mean, I question this language, and I'm glad that you had the earlier speaker about the discourse here, because we've been fed all this work about the terms flatten the curve, anyone can have it, anyone can transmit it. In the United Kingdom, we had a unit dealing with this called the Behavioural Insights Unit. It's just around the corner from Westminster, from the Palace of Westminster, and it's full of psychologists working on fear messages for the public, what I call corona hysteria. And that's released like a virus on the public, never mind about the reality of a virus or COVID-19. This is the fear that's gone ahead, created hysteria, so people conform to this stuff. But the reality is, when you look at the technology, the PCR was never, it's not licensed as a diagnostic test. It is not licensed as a medical diagnostic. It's a laboratory method for amplifying genetic material. And I would argue, as a social scientist, some virologists very strongly argue it should not be used as a medical diagnostic, certainly not on well people, because they were testing well people in all the countries of the world and telling them that they're ill when they have no symptoms. They're making cases, medical cases, out of well people. Asymptomatic people on cases. And I think that's very important for your viewers to understand, that there are great questions around the technology. They're told that these technologies work. They don't work. People test positive and negative from 1 week to the next, and their lives haven't changed and their exposures haven't changed. So there's something very wrong at the core of this technology. And I think that the public health authorities really do need to come out and be very clear to the public about these inconsistencies in the testing. And you're fed all sorts of nonsense. I mean, I've seen the document you gave me by your public health authorities in Ireland about how the PCR should work with asymptomatic people who haven't got symptoms and how you interpret it. Why would you need a document like that if the test had a clear cutoff, a clear positive and negative? It shows that it's interpretive, this test, and it needs a lot of interpretation. And nobody should have a test like this without seeing a doctor. Only a doctor is allowed to medically diagnose somebody. A diagnosis is not getting a test result. And that's a very clear message to your subscribers, that having a positive test is not the same as a medical diagnosis. It is not the same at all, because a medical diagnosis can only be made as a differential. It can only be decided upon if somebody takes a medical history from you, examines you physically, and yes, undertakes tests, and then puts all that together. And your Dr. Morrissey, I'm sure, will back me up on that. The differential diagnosis. And the core of this COVID-19 inflation of statistics happens like this. People come in with generic symptoms, sore throat, temperature, cough. Those could be many things. And a physician or a nurse practitioner will put that together with a medical history and may organize a battery of tests, including PCR, and then will decide, on the basis of the clinical and the scientific evidence, what the diagnosis is. Now, going along to a test centre and being swabbed with something and being told in half an hour you're positive, it's absolutely, I think it's criminal that this has happened on the public. And I hope, and I know this is happening in Ireland, people are pushing back, because this is like a medical fascism that's been released on the public, and it's gone too far, and it's time we stop this and we get back to personal presence and normal clinical encounters with the public. The public aren't sheep, the public aren't cattle to be herded into test centres and swabbed. This is what's happening in Liverpool, this is what's happening in Birmingham, and it's what they want to happen in Hull and all the cities in the UK. And there's so much resistance to this now, and it's going to have to stop because it's gone too far. This technology should never be used as a diagnostic, right? If you look at the data sheets that the manufacturers had, and I had them in the 1990s with HIV, and they said very clearly, Amplicor, all the test manufacturers said because they're worried about litigation. They said this test is a laboratory test that is helpful in formulating a diagnosis, but it is not a diagnostic test. And that's very clear. Your public should know that. And I would say, well, people without symptoms should not be testing. And if they're encouraged to do so by public health, as they are over here in the United Kingdom, they need to say that this is wrong and they're not going to do it.
Right.
And that's what I think. Yeah.
I think, can we get back to Pat Morrissey again and find out, Pat, are you there?
Yes. Kevin has made some very insightful and useful remarks in relation to the PCR, and thanks so much for contributing to this debate. Now, he is totally right. We were taught in medical school to treat the patient and not treat the test.
Yeah.
You know?
Yeah.
And this testing of so many asymptomatic people, which is now being ramped up and escalated, and we're seeing it, as Kevin said, in Liverpool, you know, and it's being done to a certain extent here. It's outrageous. It's medicalizing the whole population, the whole of society, and it's wrong. You know, I've come across PCR tests before, and we would use PCR tests to diagnose things like meningococcal sepsis or Haemophilus or tuberculosis or toxoplasmosis, things like that. But you'd have a sick patient, you'd have somebody who has a problem, and you would try to solve that puzzle by listening to the patient, by examining the patient, and by doing the appropriate tests. We've turned everything upside down here.
Yeah.
Absolutely.
You know?
Do you get, as a doctor, as a GP, did you receive any instructions or training at any point on how to use PCR?
Not really. The ICGP, the college are doing their best. You know, it's a rapidly changing situation here, and you know, they were very good with you know, telling us and passing down materials on infection control and referral protocols and how to manage suspect COVID cases and all that, but we need to take a helicopter view of what's going on here and what this is doing to society. And we need to have this conversation about, you know, the PCR tests. You know, you need to go back to the nuts and bolts of how this thing is operating.
Yeah.
And I totally agree with Kevin on this. And I totally agree with Sara's point earlier about this culture of fear. Like if I have a patient with a serious diagnosis, I don't tell them, go home and hunker down and, maybe, if you're really, really lucky, things will, work out for you, which is quite serious diagnosis. We're always trying to give the patient hope. We're always trying to accentuate the positive. We try and be truthful, but in this completely bizarre situation with a disease that has a infection fatality rate of 0.23% overall and 0.05% in those under 70, you know, we have the whole population petrified. It makes no sense.
Do you listen to anything that comes from NPHET anymore? I'm just curious.
Well, you know,
I have to be very careful what I say about NPHET because I'm a practicing doctor, and they are they're in a difficult situation, I suppose, and it's very hard once you've gone down a certain path to put the bus in reverse and go back to the Y junction again, you know, and decide to go down another path. And I think that they're finding it very hard to find the reverse gear at the moment.
That's a very tactful way of putting it. What we're really saying, though, is that the whole edifice that has been built around COVID-19, it's built on sand because the PCR test is not reliable. We've no data that we can go on. The those of us who think we know about viruses think that they come and go, and that there's very little we can do about it. In your practice, I can't quite figure out what age you are, but have you been through anything like this before, Pat?
No.
You're too young, are you?
Well, I did get up at the beginning of October, and I gave a bit of a speech at the Custom House.
Yes, indeed, yes.
And I got into a bit of trouble for that. But I talked about how this country dealt with TB.
Yes.
And I referred to a great statesman, Noel Brown.
Yeah.
And I said he'd be turning in his grave if he saw how we were managing things now.
Yeah.
And I still think that's true. TB was killing many more people at a much younger age over a much longer time frame than this illness.
Yeah.
And we still functioned as a society.
Yes. Yeah.
Yes.
Kevin, your experience with the PCR was originally with HIV, and I know that you have an interesting perspective on HIV that I don't think people realise how the whole situation with HIV and AIDS evolved, and I think that's of some interest too, isn't it?
Well, yeah, I worked as a staff nurse in the 1980s. You know, when I was in my 30s, I worked with HIV patients. In the days when actually was involved with HIV/AIDS in the early 80s, before we knew there's anything called HIV, even before we knew HTLV3, which was the term that was used before HIV. And it was AIDS, and they didn't know what caused it. They thought it was multifactorial. So I worked right from 1981, 82, right through into the 90s as a staff nurse and as a charge nurse, as a senior nurse and as a clinical nurse specialist in HIV. And it was only when I came to do research for a doctorate in social sciences into people's experiences of testing that I realized all the caveats that we know, that science knows about testing, because it looks watertight from the outside. But when you go inside the science, and we teach these in nursing schools and medical schools, and I've taught in 2 medical schools in the UK, St George's and York Hull Medical School, taught undergraduate medical students and nursing students. When you look at how the tests work, we know very clearly that medical tests work differently in low prevalence populations, and they work differently in high prevalence populations. And by that I mean, if you test populations, different groups of people that have a low instance of the disease you're testing for, you'll get a lot of false positives.
Yes,
and different rates of false positivity when you test a group of people, a population that has high incidence. The test again will work differently. So the tests have to be calibrated to the population that you're testing. So if you go into supermarkets and you open these test centers in public, you don't know the risk group that you're testing. You probably more often than not are testing very low risk populations, and the test will give false readings. And we know this is what's taught. I'm sure that Dr. Morrissey was taught this in medical school, how tests work in different populations. And the probability theory is Bayes' theorem, if people want to look that up, B-A-Y-E-S. And you can see the textbooks tell the public health doctors how to work these tests. And what they do tell them to do is not to do what they're doing now, is to just go out and open test centers in public and have drive-in test centers. And go and test whole schools, because the tests won't work well on people who have no symptoms, you see. So this is, and the way it worked with HIV is that, you know, you tested people who had no symptoms and gave them an HIV positive result, which was totally stigmatizing and discriminatory at the time. And now that's all been normalized to some extent with the new drugs and all the rest of it.
But is it true that HIV didn't actually lead to AIDS?
Well, it's very debatable.
It's a different subject, but
you know what's called AIDS, the acquired immune deficiency syndrome, was 29 different diseases
Wow.
that existed before HIV.
Right.
And the theory of HIV/AIDS is that everybody who was diagnosed positive would or may develop these AIDS-indicated diseases at some point. So that was a controversial issue.
Yeah.
Montagnier, the French scientist who got the Nobel Prize shared it with Barry Sanusi for discovering HIV, admitted that the virus had never really been purified. So
Another
you
case.
had a
Familiar?
Yeah, another dodgy case.
another case. And this isn't me saying this in any negative way. This is factual.
Yeah.
You can go and look at Brett Leong's film, and you can see that Luc Montagnier said this on camera, and it was given in an interview and it's transcribed, so it's in print as well. And you have to ask yourself then, we've got the same issues arising with SARS-CoV-2 and COVID-19. You've got a disease category called COVID-19, which is a list of very generic symptoms that are pre-existent before the discovery of SARS-CoV-2.
Yes.
And they've been put together into a new disease category. Now, I'm not saying anything other than that, but I'm saying that if you're going to change the whole of society and redraw us around what's a form of medical fascism or medical martial law, which is indeed what we're having in the United Kingdom at the moment, don't you think you'd like to solve these questions that scientists like Andrew Kaufman are bringing up about, is this an exosome rather than a virus? And what is a virus?
Well, the other thing
actually test for your own genetic material, and if they do test for your genetic material, then we're weaponizing our own bodies against ourselves, developing a vaccine that will be dangerous to the public. So that's the concern that, if I'm balancing the propaganda that's coming out of the public health authorities with what these dissident or alternative scientists that are not being listened to. And some of these scientists, let me tell you, like Professor Hennigan is Professor of Primary Care, Evidence-Based Primary Care at University of Oxford. He was called out by our own health minister as some idiot the other day on the radio.
Really?
Yes.
Wow.
And this is what's happening in society. That very mainstream scientists now who are coming out against the government, like in your country, in Republic of Ireland, and they're being sidelined, and they're not saying anything about the isolation of the virus. They're just saying the tests don't work well, and they're being sidelined. And that shows that there's a political rationale driving this, a political rationale that's fed by vested interests of big pharmaceutical corporations who are benefiting from this. The public are not benefiting from this, like Dr. Morrissey said, people being locked away like battery hens. We don't do this to people. These are people. This is a technocratic order of medicine that's coming in, and a technocratic order of society. It's anti-human, anti-spiritual, and it is not what we want. People don't want to live like this.
No.
People want to be able to assess their own risks, like we did with flu. Look, we always shielded people with flu. And Carl Hennigan showed at the University of Oxford that this is an influenza-like episode. That's what he said. And he said that in April, and he was ignored. And now he's being pilloried by our health minister. And it's not just him, it's other very decent, well-known, totally robust scientists that's been sidelined in this country. And that's going to have a really big backlash. Alison Pollock, our professor of public health in University of Newcastle, came out last week against the citywide testing. She said there's no science, no robust science for it. There is no scientific rationale for it. I'm a claimant in a judicial review that's going to the High Court in London, the Tilbrook Review. You can look it up, it's online. And we went through the SAGE minutes, which is the science group that advised Boris Johnson. There was no evidence that the SAGE scientists advised our government that masks should be worn in public.
Wow. Oh, that's a new one.
It was a political decision. Masks were a political decision, not a scientific decision. And you can say from that, there's some big questions about why, if it's not a scientific decision, are we advocating masks in enclosed public spaces. You know,
I think
I've got a master's degree in nursing. It's in respiratory medicine. I did an experiment with COPD and asthma patients. I was a specialist in that area to some extent. And there is no science basis to masking. There's no randomized controlled trial that shows that masks prevent viral transmission. And they should never have been advised in this country or in any country to wear masks. And it's getting ridiculous because people are wearing masks not in closed spaces.
In the rain.
They're wearing outdoors. They're wearing. I'm in central London, in the city of London, and I'm seeing people with black marigold gloves and double masks. Yeah, and then they take the mask off and they start.
Oh, you're joking?
And they think that's respiratory hygiene.
Wow.
Yeah, and I go into Tesco's in the city of London, and I'm being told, "Where's your mask? Where's your mask?" And I said, "I'm not wearing one, and I'm never going to wear a mask. And what are you going to do about it? And by the way, do you want my money or not? Because if you want my money to keep your job going, let's just get down to the transactions." So that's how I'm dealing with it anyway.
Yeah, I think
so.
Yes,
but I
think
the people
yes, sorry,
to
Kevin.
know,
You go on.
Lindie, people need to know that science is full of uncertainty.
Yes. And
science only proceeds through uncertainty. And what public health doctors like doing, and epidemiologists, they have a model of the public as stupid, ignorant, and they need to be told a simple message, right? And the public is not ignorant or stupid. The public is as sophisticated as any scientist. They may not have a doctorate or PhD or whatever you want to call it. People are very intellectual. We are born that way. God creates us as intellects. We're God-given. We're born in the shape, in the form of God, and we're treating the public as their student. And
you faded away there, Kevin.
It's science as propaganda, Lindie, I'm saying. Science has become propaganda, like the French philosopher Jacques Ellul said in the 1960s. Modern science has become propaganda. We've had a very good example of that all this year. All the statistical projections are all modelling, and they've all been shown to be incorrect.
Yes, exactly.
Modelling is incorrect, you know. The reality is something different. And Dr. Morrissey, in his practice, is dealing with the reality of this, the shame of this, a cardiac patient who didn't care for when he should have, people being isolated at home, socially, psychologically damaged. That's the reality of this, and we stop it. I think stop it now. Call an end to this psychosis. It's a mass psychosis being engineered for what purpose? This isn't doing the public any good.
Yes.
13 years helping people in health, preserving life. And what am I seeing? I'm seeing people's careers wrecked, their businesses destroyed, their psychology damaged, their children abused in schools with masks and social distancing. And when are we going to stop this? You know, when is it going to stop? When are the virologists and the epidemiologists, when is the R number low enough for them? When is the R number ever low enough?
Right, Kevin, I think we're going to have to stop there. But brilliantly said. You've summarised it all very well. We'll come back to Sara for a moment. Just, is there anything else you might add? I mean, one of the things that Kevin was saying is the use of language, that if you don't wear a mask, you're accused of trying to kill your granny and that kind of stuff.
Absolutely. I think there's this whole, the language has been developed to divide people rather than, this whole thing of we're all in this together, apart, and all these, contradiction in terms, social distancing, it's saying, we're not allowed to socialise, we're not allowed to be together. And unfortunately, because people are so entrenched in fear now, that if they see somebody without a mask, or they see somebody protesting about lockdowns, or asking questions about vaccines, immediately there's this attitude of, well, you're anti-mask, you're anti-lockdown, you're anti-vaccine. That means you're pro-death. Yes. That means you don't care. That means you're selfish. That means that, you're out for a laugh. It's like, actually, people speaking up and speaking out, it takes huge courage. It really does. It's not easy because, the herd mentality has really kind of, taken over. People are so afraid, not just now of the virus, but also what will other people think? What would people think of them? Do they think they're really awful people, for wanting their lives back, for wanting their children to be happy and to be,
As a kind of a sort of a psychologist sort of person, can you actually see a way back where people will suddenly realise, I can't go on living like this, and I'm going to throw away the fear, as FDR said, we've nothing to fear except fear itself. How do we get to that stage?
I really hope so, and I think what happens is people, everyone's on their own journey in this at the end of the day, and I think, for me it was April, when I heard this thing about no going back to normal without a vaccine, and I suddenly went, well, how's that? How does that work? And I went, no, that's not true. I just went, well, what does that mean? And I think everybody has their own wake-up moment, and often it's when it's really affecting themselves, like if it's their children struggling at school, with the masks and with the social distancing, or if it's a relative who's now trapped inside a nursing home that they haven't seen since March, or they've got a misdiagnosis and they know maybe there's something wrong. So I think when people, it really affects them personally, I think people tend to kind of, want to wake up. I think it's about people really trusting their gut instinct. If they think something is wrong, I have a little 4-step thing, which is stop. Just stop for a moment. Stop listening to all of the daily reports on cases. Now we kind of understand there's a little bit more to these cases than just people who are actually sick or in hospital and dying. They might be completely well people. So we've got this number and it doesn't really mean anything. So just stop for a moment and breathe. Take a breath. Take a breath. Just bring the anxiety down. Breathing is so important. That's why masks, to me are so insidious, because they are blocking oxygen, and people can say they're not, but I've worn one and I cannot breathe in them. I don't care what people say, and and you set up an anxiety cycle with that as well. So just breathe. Just bring yourself into the present moment and really just notice right here, right now, everything's okay. Then think, does this make sense? Is what you're being told, can you see it with your own eyes? How many people do you know yourself who've been seriously ill, been in hospital or died? I'm sure there are a few people, of course. I'm not a COVID denier. It's the extent, it's the proportion of the measures against this. I don't know anybody personally who has been in hospital or who's died from this. I don't. And I don't live in a huge place, but at the same time, you would think you would know somebody by this point. And then the last part is go. Don't believe anything anybody tells you. Go and do your own research. Go and investigate. Go and dig. Go and find out about these things. Anything your gut instinct is telling you is not completely right. Don't believe anything anyone else tells you.
Yeah. Dr. Pat, are you still there? Have you any final words on the subject?
No, I'm delighted to have joined you this evening. I found it very informative, and we've got away from the fear and we've injected a bit of positivity, and that can only be good and healthy, I think.
Yeah, that's a very good message. So I think I'd like to thank our 3 excellent guests, Sara, Kevin and Pat, who I think we've all learned a lot from. We'll be back next week, and we have a message from our organisers, which this show, just to let you know, is independently produced, and we'd like to keep it that way. If you'd like to help us out with a donation, click on the link, which you will find somewhere on the screen. So thank you again to everyone for a very stimulating discussion, and we look forward to seeing you all back again next week.